Hello, my name is Joanne Pong. I am a chronic pain specialist at Manual Physical Therapy, and our unique treatment method is called body recalibration method. And so I want to share with you how we solve problems here every day. Our patients typically will feel a difference at the end of the session. So what happened that I want to share with you is that a patient came in with a knee problem, and the knee problem was in the pain was in the inside of the knee, and it was very painful when she was walking. And so the treatment was about how can I make her feel better? How can I make the knee feel better when she's walking? So I did two tests. One, I had her march in place. And so when she marched in place just three times, I saw that the right foot was actually turned out slightly, which tells me that the pelvis, because I was testing the pelvis was facing right. And then the next one that I did was I had her cross her leg like this. And I looked at the knee, the height of the knee, and then the other knee, and I compared the two of them, and the right knee was higher. Now, ordinarily, if your pelvis is facing right, that knee on the right side should be lower. But in her case, it was higher. So anytime we recognize inconsistency, that tells us that a rotational muscle is involved. And so, what is the rotational muscle that stood out to me was the sartorius. And the sartorius, as you can see in this picture, is it starts at the outside of the hip and it crosses diagonally and it inserts into the inside of the knee. Now, one thing I'd like to point out is when you see the yellow, that's the attachment. And then when it's orange, that means the muscle is floating. So if that muscle is tight, you can just see that it would create pain on the inside the inside aspect of the knee. Just like if this is a muscle and this is the yellow part, that's a yellow part. If the muscle is tugging, it of course will hurt in the at the attachment level. And so that is how I figured out that that was a problem. So I released it. Release just means relaxed it. And so afterwards, I had her walk, and her pain was 90% better. So I hope that helps you to understand that just because you have a medial knee pain and you have bone on bone, it does not mean that the bone is the one that is causing the pain. It could very well be tight muscles. So I hope that helps.